I can take care of that, Pierrette.
Oh, I think I actually just did it.
Okay.
All right. Thank you for everybody attending today's webinar. We were quite overwhelmed with the reception that our invitation got. I'm going to start off, I wanted to start with a poll, but I didn't quite get that organized. But I'd like to acknowledge that there are people who are interested in this program, which you've applied from, or you're interested in applying from across Canada, not just from Ontario. And I saw a number of emails that suggest you could even be applying from international locations. So that's great too. Thank you very much. And I'd also like to acknowledge that we are on treaty lands, at least I still am, and the Dalalana School of Public Health is as well. And as settler people, we appreciate the opportunity to live and work alongside of our First Nations and Indigenous colleagues. Thank you very much. Okay, I'm going to get started just to make sure that we can get to your questions as quickly as possible. I'm going to speak a little bit about our updated program, about awards and financial support, what happens if you're already a dietitian, and the elephant in the room, which is COVID-19, and of course, how to apply. And I suppose I should probably begin by introducing myself, which I overlooked. I'm Pierrette Buchlas, and I am the program director for the Nutrition and Dietetics program at the Dalalana School of Public Health. And our program is not only a Masters of Public Health, but at the end of the program, our intent is to have our graduates also achieve all of their practical training competencies for dietetic entry to practice. Okay, so we have updated our MPH in Nutrition and Dietetics over the past few years. Tracy, who is online with us today, will attest to the fact that it has felt like a continuous evolution, but in response to feedback from our preceptors and our past students and our accreditation cycle the last time around. We have made changes to strengthen the various areas of dietetic practice that our students are exposed to. We have made changes to better prepare our students for their entry into the placements that they do through our program. And we've also tried to make changes that would allow our students to better engage with the School of Public Health. We think we have a huge asset to our applicants and to our students in that we are situated in a graduate school of public health, and we are in a division called Clinical Public Health. And this allows our students to interact with issues and students from all kinds of disciplines that would touch dietetics and benefit from dietetics involvement. And so we're trying to make sure that you have as many opportunities as possible to engage with the programming and the courses that are available through Dalalana. Another thing that has just begun this year is we've created a clinical nutrition emphasis as an option. And this allows students who have a big interest in clinical nutrition to engage directly with our UHN partners in tertiary care nutrition and learn on-site at UHN. This is there's an additional course requirement as well with this. We can talk a little bit more about that in the next steps. But we also have a public health nutrition emphasis on the books. Many of you have already begun to ask about this. Unfortunately, I think you can appreciate that right now our public health colleagues are quite preoccupied with the pandemic. And so we don't see that this option will be available to our students who would be entering the program in September of 2021. Clinical nutrition, however, continues to be an option. Many questions come to us about the program and how it stretches over 2 years. One of the things I would like to emphasize, and this is really important, is that our whole program is accredited as a program of dietetic practical training, not just our placements. And so the accreditation group that looked at our program is satisfied that the kinds of assignments that you do and the work that you do in your courses as well as your practicum courses is part of the dietetic training that we offer. And there are very directly practical opportunities through those assignments that would be helping you to develop competency and arrive at readiness to practice. You'll see that in year one, term one is a fairly heavy looking term, but it is also totally coursework and preparation. And it's preparation for both the Masters of Public Health and for placement. So you'll notice that the introductory courses, Introduction to Public Health Sciences, Introduction to Quantitative Research, and the Public Health Policy courses are foundational to all Masters of Public Health students. And these courses will also enable a lot of the work that you'll be doing in your placements. Then you get into a series of very specific dietetic related courses, the Foundations of Dietetic Practice 1, 2, and 3, that are divided up like that to focus on different areas. So Foundations of Dietetic Practice 1 tends to focus more in the community realm and in some of the management competencies. Foundations of Practice 2 focuses on some of the building, if we will, some of the readiness to enter clinical practice. And Foundations of Practice 3 addresses competencies in the areas of some population public health, some professional practice, and some communications. Once you've completed that first term on campus, that's when we begin to move you out into placement. So in January of your first year, you would move into placement, and we have a great deal of placement required, partly to meet the requirements of dietetic training. And at this stage, we divide it into 3 official courses, but from a rotation point of view, you would have different rotations in clinical work, where there's at least 12 weeks of clinical guaranteed to every student who's in our program, notwithstanding the clinical nutrition emphasis, and at least 4 weeks of population public health placement, and at least 4 weeks of food service and management placement. And then there's an additional 4 weeks where you can move into areas, you can extend areas that you're interested in, or you can move into an area that hasn't been addressed by the placements you've received as foundational. Then in year 2, you come back to campus. On campus, you're taking a couple of required courses in the fall, and then you're also filling in electives as they work. But you also begin a Nutrition and Dietetics culminating project. And we intend for this to build on your experience in placement and allow you to do a real world project in an area that relates to the area you hope to work in the future, to allow you to have more experiential background in that area, but also to allow you to get to meet people, develop a network, and start to understand where you might fit into that as you move into your career. And in the final term, you're still working on that culminating project. You're probably actively preparing something that will be important to a community agency of one kind or another. But you're also doing at least 1 course, possibly 2, if you have electives as well that term. And at the end of year 2, in a full-time program, almost all of our students graduate. Things often happen that make it required to take a little bit of extra time, and that is entirely possible into the summer of your second year. But that is not the case for most of our students. Nearly everybody graduates with the June convocation. Let's talk a little bit more about that clinical nutrition emphasis. If you're coming into our program and you've been accepted and you know that you want to focus on working in a tertiary care hospital setting and you want to develop high-level competency in nutrition care, this may be something you'd be interested in. You have to be doing dietetic practical training in order to get this. So some students who come in already with a dietetics background, this isn't open to you. But for those who are coming in to do their internship, to borrow a word, you'll be thinking about this in the spring before you start the program. This may be compatible with another area of additional work that can be noted on your transcript called a collaborative specialization, but that is tricky because of the demands of the emphasis. So we encourage you, if you are interested in both, to have a chat with myself or our associate program director early in your decision process so that we can be aware and help you to choose courses that would be consistent with achieving both. The requirements for that clinical nutrition emphasis are that you use at least that extra 4 weeks in a clinical setting, and you would be spending it in a series of rotations with UHN. There would be an additional course requirement. You would take either the theory and practice of behavior change in health professional settings or clinical nutrition. And then in that culminating project, you would be doing a project that would be directly related to some of the work that you've done in a clinical setting at UHN. Successful completion of a clinical nutrition emphasis, as I mentioned, would be noted on your transcript. And it also gives you the opportunity to talk in your resume about your additional skills in that area. I often get questions about awards and financial support, and there are awards for our program. We have 2 scholarships that are available to incoming students, the Daniel Haas Memorial Scholarship and the Grace Waymark Morgan Scholarship. These are largely based on grades from your undergraduate program, but they also may have some relevance to the type of study you wish to engage in or what universities you've graduated from. Each of these scholarships usually comes in around $3,000 as an entry scholarship. And our students are also eligible for DLSPH, that's Dalalana School of Public Health Merit Scholarships, which are awarded at program entry to top-ranked candidates. We usually get 1 or 2 of those each year, again, $3,000 to $4,000. And then all of our students are given a $3,000 grant without any application process involved for your first unpaid 8-week placement. And many of our placements, unfortunately, are unpaid. So this is something that nearly every one of our students gets. If you do receive a stipend of some kind for a placement, what would happen is you would get the portion of the $3,000 that is not covered by your stipend. There are other awards and financial supports, and I've provided the website here so that you can go take a look and see what ones might interest you. I strongly encourage you to know about them before you come into the program, because once you're busy in the program, sometimes making those applications is a little bit more difficult. But we have had several students be successful with several of these additional awards through the school. Okay, so some of you are already dietitians, and we need to talk about what's different in the program if you are. If you are a dietitian who's recently graduated, but you're interested in completing a Master's of Public Health, we would still have you follow a 2-year program that would require 10 full credit equivalents for graduation. But there are exemptions. You wouldn't need to take the foundation courses because those are very specifically related to developing dietetic competency. And you only require 1 full credit, not 3 full credits of practicum in order to graduate. So what this does, if you're already a dietitian coming into the 2-year program, is it gives you a lot of extra room for electives and research projects and other activities that may be suited to where you'd like to take your career. We've had students who are dietitians who've come in to do the 2-year program end up with multiple collaborative specializations, usually no more than 2, but that represents an additional series of electives and papers. And we've had students who are already dietitians engage in projects that have taken them out of the country and have led them into their careers after they finish the program. So this is definitely an interesting option even if you already have finished your internship. Now, let's say that you've been a dietitian for 5 or more years by the time you would begin our program. That would make you eligible to apply to our advanced standing program. And the advanced standing program is created to be completed in 1 full-time year, recognizing that with 5 or more years worth of work experience, you've probably got some of the experience that we develop through 2 years worth of a master's degree. And so if you have been a dietitian for a few years already and you're thinking about what your credentials look like and how that helps you in your career and your professional interests, there may be a way for you to complete our Masters of Public Health in a shorter amount of time. COVID-19 is the thing that's affecting everybody right now. And we know that our programs are going to be virtual for the rest of this year in terms of coursework. This the university has confirmed so far. We don't know beyond the end of March what the university's flexibility will be around virtual course delivery. And we need to be clear with everybody that our program had never previously been set up as a virtual or remote learning program. So what we need to consider is if you're applying with that hope, we can't offer the guarantee, and you may find yourself required to come to Toronto to complete our program. Perhaps more information will come up in the next few weeks, but at this time, that's the way we're positioned. And COVID-19 has had a big effect on our placements as well. As I'm sure many of you can appreciate, We have had a lot of students displaced as there was closures back in the spring. And we have found ways to help them move forward using remote or virtual placement options and finding opportunities that exist in their locations. So we've had students who've been weathering the COVID storm at home with family or in different parts of Canada, and we've been able to find them placements in those neighborhoods once placements opened again to prevent them from having to make a big move back to Toronto with an uncertain COVID future. We are also in the process of collaborating with other schools of dietetic teaching to explore how we can work with practical training and other approaches to delivering that kind of training that don't have to involve as many weeks in placement. And hopefully we'll have some better answers on what that looks like in the coming months. But for right now, we've got our hands working together with other schools, which is kind of a novel approach, since many of these schools tend to be competitive with one another. But in dietetics, we understand the need for us to put our resources and our ideas together to solve this problem. So we are expecting that placements will be continuing and that our students will continue to receive the required training in order to achieve their dietetic practical training. And of course, the question to end all questions, how do I apply? Well, I want to be clear that we do not have applications for this process through the Ontario University Application Centre. This is our applications are all handled through the Dalla Lana School of Public Health application portal at this URL. And so if you are interested in applying to our program, it's very important that you take a look at this, understand what the requirements are, and prepare to submit your application materials here in time for the deadline dates. Our applications for September of 2021 are due by January the 18th. So you have some time right now. If you're looking at our 2-year program, you should start thinking about who your references might be, because I'm sure that they're quite busy as well, and requesting transcripts, which can be delivered electronically at this stage. They usually are, but even more so under the circumstances that office staff are not handling a lot of papers. Now, I want there to be a note that the advanced standing applications happen earlier. We did this for a couple of reasons. One, because our advanced standing group usually have some additional changes to plan in their life if they're coming back to school, and having a little bit of extra time is a good thing. And number two, because we wanted to ensure that we weren't confusing applications for the advanced standing program with the regular program. And so advanced standing applications are due on November 27th. And now the floor is yours, and I'd really love to hear what kinds of questions you would like to ask. If you need to use the chat, please do. We've got Tracy Burke monitoring that as well.
Hi, my name's Farida. Just a couple questions.
Sure
Is there
thing.
any part-time program for the advanced standing program?
Yeah, the university does allow part-time studies. They don't allow us to have too many students in that situation, because it makes it very difficult to make sure you've got all of your required courses and things. But in the advanced standing program in particular, there's a great deal of understanding that you may be working concurrently. So we can accept students on a part-time basis.
Okay, Pierrette, we have some comments, some questions coming in the chat now.
Okay.
So I'll just read those out. Sure. So the first one, for academic reference, do you prefer a professor that taught us a nutrition course?
Okay, great question, because we don't technically require academic references. We require 2 references. It's helpful if somebody who has taught you before knows your work ethic and can assess whether you're a good candidate for graduate education. But mostly we want you to have references who know you as a candidate and who think that you'd be able to make a great dietitian in the future. So please don't feel like you have to go and contact all of your professors to see if you can gather your references from among them. We are really interested in making sure that your references know who you are.
Okay, thank you. Next question here. What are the major differences between this year's application and last year's application process?
We were just talking about this recently. In the past, we've had in-person interviews for the candidates who were considering for admission, and that is obviously not going to be possible this year. But basically, the paper application online is going to look exactly the same as it always has. And we are going to be structuring a series of virtual interviews. We haven't quite sorted out what that'll look like yet, but we will continue to have an interview process that also goes along with the paper applications.
Okay, next question. If you're interested in the clinical emphasis, do you need to apply separately, or do you decide once you're already in the program?
Great question. Thank you. It's like I planted that one. As a matter of fact, the clinical emphasis is only open to people who've already been accepted into the program and has accepted our offer. So what happens is you hear from us about whether you're in our program, and then you have an opportunity to apply within the program for the clinical emphasis. So it's a second step that happens in this late spring.
Okay, next question. For internationally educated students, what kind of CDO assessment do we need, PLAR or paper-based? And what happens if we lack competencies?
Okay. I'm going to start with the international. International applicants are welcome to our program for sure. If you are an international applicant who comes from a US Ascend accredited undergraduate program, you can apply just like a Canadian educated student who has been in a dietetic program. If you are applying with background in another way from an international university, what we do is we have you work through the College of Dietitians of Ontario's assessment process, and they've got two mechanisms, but what appears to be the preferred mechanism at this time is that you write the KCAT test, and through that knowledge competency assessment test, they will give you a ranking. We're looking for a level 1 in order to say that you have the same background as somebody from a Canadian undergraduate dietetic program. And at that stage, then we would be able to consider your application among our pool. Now, I need to let you know that that test is offered in February, and they don't offer it at different times of the year. So if you need to write that test, unfortunately, you wouldn't have all of your application materials ready for September 2021 admission, and you would need to apply for September 2022. The second question about competencies, I'm not sure I follow entirely, but if you're talking about academic competencies that are achieved in an undergraduate program, the KCAT test will assess whether you have the same sort of baseline knowledge about the field as we expect. If you do not complete that at a level 1, then it may be that in writing it, you'll recognize where the areas were that you need to do a little bit more work, and can complete that through individual study or taking additional courses if that's something that you'd like, and try the KCAT again. But we don't assign those competencies. As for people in our program, the practical training competencies are what we help you to work through. And from day one, we start working on achieving a C competent level across all of those competencies by the end of your 2-year program.
Great. Yeah, the example here was dietetics in the Canadian setting, so I think you captured it with the KCAT.
Okay.
Okay, next question. Are interviews going to be held online?
In all likelihood, yes, but we're also exploring telephone. We haven't quite made our decisions yet. We're trying to make sure that if we are online, that the technology is going to work for us and not get in our way.
Okay. And so you've mentioned that the grant covers the first 8 weeks of unpaid internship. Is there paid opportunities for future weeks, or are domestic students eligible for OSAP?
Okay, the answer is yes to both questions. So let me start with domestic students are eligible for OSAP. This is a graduate program. And so just like any other graduate academic program, this would be something that you could apply to OSAP for support. However, it's also possible that you could get paid placements. And to be tricky, what we usually try and do is if you're going to end up looking at something that could be a paid placement, and there aren't lots of them, we try and make sure that's not your first 8 weeks of placement. We try and make sure that that happens afterwards so you can get the full benefit of that placement. But I do have to caution, there aren't a lot of placements that are paid for our program. I wish it were the case. Some of the other programs have mostly paid placements, and unfortunately, dietetics is not quite in that boat. We're continuing to try and fight to find ways to provide you with better access.
Okay, next question. As a prospective international student, can I apply while I'm still an undergrad senior and my degree can't be evaluated yet by WES and CDO?
Okay. I'm not as concerned about WES, that the School of Graduate Studies might be very interested in, but I'm very interested in the College of Dietitians of Ontario. And so if you're not in a position where you would be eligible to write the KCAT, and you would need to in order to be considered for application for our program, then you're going to have to wait. There are universities, and I'm thinking about a couple of them that are Ascend accredited that are international. And Ascend is the US-based organization that accredits these dietetic programs. In those cases, you could apply in your senior year. But for most universities where you would need to use the KCAT route to be assessed, you'll need to wait until your program is complete.
Okay, lots of great questions coming in here,
Yeah.
Kirat. Next one. I'm wondering if there are any placements overseas. I heard there is a global specialization. Can you please explain this option?
Yes, I would love to. That is a very popular collaborative specialization. Before I get into that, I would like to talk a little bit more about these collaborative specializations. They are a subspecialty within the Masters of Public Health degree that any student in the Dalla Lana School of Public Health can apply to be considered for. They usually involve a dedicated placement of some kind, and they usually involve some additional seminars and a course, at least one. So there is extra weight on your schedule in order to complete a collaborative specialization, but we've had students over the past couple of years successfully completing many. Women's studies is often one, health policy is often considered. We've had addiction studies, global health is a very popular one. So we've had students involved in many of these and complete them successfully. So let's talk a little bit about global. In a normal year, yes, there are a limited number of placements that are available overseas, and we have had students who've been in Africa, who have been at the World Health Organization. We have had students who were accepted for placements last year. I think it was Norway, and I'm not sure if we had one in Asia, but they had to be canceled. And so that's something that we're still grappling with. The other side of this, for those of you who are interested in a global specialization but may not be able to travel internationally, whether it's because of COVID or because it's simply not feasible for you, you can do a global placement in Canada. And so keep that in mind. We've had students who've completed globally focused work at the Hospital for Sick Children. We've had students who've completed globally focused work with agencies in Ottawa or World Vision, for example, and it's entirely possible. So both angles are possible. We've had some wonderful experiences where students have been able to go abroad. Oh yeah, Australia was another one of the ones last year that wasn't able to happen. But we also have been able to successfully have our students get that experience without having to leave Canada.
Okay, thank you. How many students will you be accepting this year?
We haven't heard that our targets are any different from the past couple of years. So the past couple of years, we've been asked to accept 25 students into our 2-year program and at least 2 students into our advanced standing program. And we this year ended up with 26 students in our first year or 2-year program, and we ended up with 5 students in our advanced standing. So it somewhat depends on the quality of the applications, but our baselines would be probably the same number, 25 and 2.
Okay, And someone's wondering if they took biostatistics in undergrad, does that count as their statistics background?
Yes, I would say so. Now, if you're applying from a dietetics program, we understand that they may be called different things when you're in the dietetics program, but we acknowledge that you've all achieved that statistics requirement through the dietetics undergraduate program as approved in Canada or the US. If you've done more than the required amount of biostatistics, and we've had a couple of students who have, we may be able to even arrange for you to be exempted from the introductory quantitative methods course and take an elective in its place. So yes, I'm sure you're covered for entry requirements, but some people who've been engaged in math-related statistical parts of their degree beyond what's required for dietetics have also been able to get a course exemption that allows them to have an extra elective.
Okay, a comment, thank you for the information. Does this program only have a fall start date, or is there an option to start in January?
We are a fall start. There's a lot of moving pieces with our program, as I'm sure you can imagine, with respect to the courses, making sure that we're introducing things before you are thrown out into placement and so forth. So we've basically been held to a fall start.
Okay, question here, what do the virtual placements typically look like? What would students be doing to fulfill the dietetic competencies through online methods?
Yeah, they've been all over the map this year, but even before that, we've had some that have made sense. So as an example, we had 2 students whose food service placements were interrupted by COVID. And we also had found out about a setting where they were a small regional hospital that needed to now set up a field hospital for COVID patients. And they had to replicate their entire food service structure for the field hospital. And there was one dietitian on staff at the hospital who kind of filled all the roles. So our students were able to, from 2 different locations that were different from the regional hospital, assist the dietitian with some menu planning, with identifying equipment that needed to be procured, with reaching out to create job descriptions for additional staff that would need to be hired, and basically supply this dietitian with a package that she could use as turnkey when the time came for them to start working on the field hospital. So that's an example. Other examples include in population and public health, doing projects that involve writing or online courses or developing systematic literature reviews for issues of importance on a population level that relate to the work being done at Health Canada, for instance, or the Ontario Ministry of Health, or for a local public health agency. And we've even had virtual placements for clinical now, since so many of our dietetics colleagues are starting to work in an online way to continue to meet the needs of their patients during the lockdown, that we've had them working with our students and including them in their virtual consultations. So there's been more of that kind of experience as well, although most of the nutrition care clinical work is still being done in person.
Okay, a question here about the timeline. So wondering when the interview invitations and final offers will be sent out.
Okay, if I can go by last year, which I hope will be true, we receive the application. So you sent all the material in by mid-January. We received the application material in the first week or so of February. Then we set about reviewing the many, many applications we receive and set up our interviews for the end of February or the first week of March. Our decisions are made fairly rapidly after that, and usually by mid-March, we've sent, now this is important, we've sent our recommendations to the school to be able to send out letters of offer. We've probably been in touch with those candidates already to let them know that a letter of offer should be coming, but the letters of offer sometimes take longer to show up than you'd think, just because they're dealing with not only our program, but all of the programs. So our process and your notification that we would like to recommend you to move forward is usually wrapped up by mid-March.
Okay, so the next 2 questions are about the letter of intent. So kind of a question, any tips for writing the letter? And a more specific question around formatting, should it be phrased like a letter versus headers?
Okay, this is a bit of a, we don't have formatting specifications. So we just want to see that you're within word count and that you can succinctly explain to us how you are providing a response to the questions that we ask. It can be a letter, dear sir or madam. It can be a paragraph form, a short essay, if you will. Those are all acceptable to us. What we're looking for is the content. Having said that, the content is really important. So we hope that you will not only look at our questions, but also review our website to understand our particular point of view and our school's approach to things so that you can answer the questions being informed about the kinds of things we might be looking for in a candidate. Where we ask for clinical public health, we'd really like to know that you've done some thinking about what that means to you and how you might see it being applied in your future career, for example. It's a way for us to get to know you.
And Pierrette, is the application link live now?
It is. It went live yesterday.
Okay, so I guess someone's wondering if we can share it. Is it on the Nutrition and Dietetics homepage? Or?
It is through our application process. I also did put it in the in that slide. So when we post this, you'll be able to see it there. But if you go to the Dalla Lana School of Public Health and you query applications, you should get a lot of information very quickly that leads you there.
Okay, great. And are applicants eligible to apply for the OGS?
Oh, yes. Yes, and please do. We've had students be successful for that in the past, and it is a wonderful boost to your ability to continue the program. It's a tough competition, I'll grant you that, but it's worth the effort given the size of the prize.
Okay, and this question is from a dietitian licensed with CDBC, and she's wondering if she has to switch to CDO before applying.
No, we're not concerned about where you're registered. We just want to know that you are a registered dietitian who's been practicing, and that will put you into a different category of consideration if you've been working for 5 years or more.
Great. And Amanda posted the link there for the application process.
Oh,
so thank
you, Amanda.
Okay. Next question. The application instructions website notes that at least one academic reference is recommended. If we use all work professional references, would this put us at a disadvantage?
That's a tough question. I mean, it really does come down to your references being able to speak to your ability to be successful in graduate school and in the career. If you don't have a professor who knows you well enough, we don't want you to be limited in finding somebody who will basically check boxes and say general things that aren't meaningful. I think in a case like that, Tracy, you've been on the committee with us. You can back me up if you think there's a different way to look at it. We would rather see two professional related, work related references who can speak to you as a candidate. Yeah,
I would agree. It would not be a disadvantage if you had good references that knew you outside of school. Yeah. Some excitement here around the global opportunities. Are the interviews done individually or as a group?
Again, we're not sure quite what that's going to look like this year. For the past couple of years, we've been doing MMI interviews, which brings a group of people together, but then has you do one-on-one discussions about specific questions with a member of our faculty team. So at this moment, we're exploring what the possibilities might be to use a facility like Zoom to be able to have those same kind of one-to-one discussions. And then we usually gather everybody back for a Q&A session as well in a group. But I don't know for a fact what we're going to be able to achieve this year.
Okay, next question. Can we apply for a TA position during the program?
You can. Some of our students have been successful in their second year applying for a TA position. One of the challenges is that as a professional master's, there aren't as many TA opportunities available. And when we're thinking about things like nutrition science, for example, they usually end up hiring from within the Department of Nutrition Sciences for their TAs. However, sometimes there will be TA opportunities with a first year course where a second year student who's completed the course can assist, and sometimes other courses on campus where you may have a natural fit. Let's say you did an undergraduate minor in sociology and you would like to apply for a TA role in the sociology department, there may be an opportunity for you to take those on as well.
Okay, a question about placements. Are they mainly in the GTA or can they be anywhere in Ontario?
Wow, this is the question of the century. At this point, if it was any other year, I would say mainly in the GTA, because we have so many programs in Southern Ontario that are doing dietetic training that we've got a handshake agreement with most of the other schools to not cross into their territory to seek placements and eliminate them from being able to access placements. However, now things are a little different. And because of COVID, everybody is a little bit more understanding about students who are not in the GTA to be able to be placed. Even in a non-COVID year, when we've had good reasons, we've been able to place students in BC, which was home for them, or even Kingston. Out east, I think we had at least one placement in the past, but now that's becoming a little bit more easy to do. So yes, mostly GTA, but having said that, the world is a changing place. So lots of things are possible that weren't so easy before.
Okay, question here about what does a perfect application look like?
Oh my goodness. Well, a perfect application is a great representation of who you are. So it really helps us to see how you are a great future dietitian and how the work that you would like to do is going to make a difference to health in your part of the field. So tell us whatever you can that helps us to get to know that about you. We've had applicants who haven't had the strongest academics. You have to meet the basic requirement that the School of Graduate Studies sets for a mid-B. But if you've met that and you have outstanding experience, perhaps volunteer experience internationally, or perhaps you've had some kind of work role that is outside of dietetics but really applicable, that's a great thing for us to know more about, because it gives us some insight into the tools you bring to the profession and as a student what you would be prepared to dive into. We need to know that you're going to be capable of handling the material at this level and that you're going to be out there representing well for the profession once you graduate.
Okay, next question. What are the components of the interview process? And kind of a linked question to that is, for the written component, is it more science-based or more social science-based?
I would say probably more social science based. We're not asking questions that relate to your understanding of biochemistry or human physiology, but that's because we've seen your transcript. So we know if you've already got that stuff under control. We are interested in your approach to situations. As a candidate, we would like to know that you'd be able to handle situations that are common in dietetic practice as you would be as a learner, to be able to show us that you're ready to start working in that direction.
Okay, and then the components of the interview, I guess, written and the...
Yeah, that's a little bit to be determined. Normally, we have had a written question and then several verbal questions, but I just can't tell you this year.
Okay. How many applicants does the program normally receive?
Over the past 5 years, we have received between 140 and 160 applicants each year. And so to get to our 25, you can see that it is quite competitive. But as I've said, it's not solely based on grades. That is an important component, of course, but we are looking for the candidates that we think are going to be most well suited to our approach of training, are going to be successful at their graduate studies, and are going to become the kind of dietitians that we would be proud to say we've trained.
Okay, so here, this comment is from a former grad of the community nutrition program. She's happy to see the changes, and she's wondering if you could confirm the proper way to list the degree on a resume. Should it be community nutrition / nutrition and dietetics? or formerly known as.
Yeah. Okay. So if you've already graduated from a master, I'm a candidate like that too. So I still list my degree as Master of Health Science, Community Nutrition, where I even put the community nutrition part anymore, because that's the degree that was conferred on me. And you can't change the degree that was conferred on you. So all of our students now are a part of the Masters in Public Health in Nutrition and Dietetics. But for those of us of a previous iteration of the program, it is whatever the university offered you at the time.
Okay. So next question, for references, can it be a person that is not physically in Canada?
We have had references from people who are not physically in Canada, especially as that relates to students who are not coming from Canada. Again, the same things apply. We would like them really to be able to speak to those qualities about you that make you great for dietetics and suited for graduate studies.
Okay, next question. I have an undergrad degree in Canada, but during the summers I was working outside Canada. Oh, so similar actually. Is an international reference acceptable? Is there a time limit for how many years ago I worked with that person?
I think you'd have to decide whether that person is the best reference for you now. If you haven't been engaged with them a lot over the last few years and you've grown professionally in ways that they can't speak to, it may not make them the right candidate for your reference. If, however, they are going to be able to speak to something that you think is really important because, let's say, they were engaged with you as you were a student and you need somebody to be able to say you've got the goods to be able to do a graduate program, then we're not as focused on how many years ago. We just really need to have that sense that they can speak to your abilities.
Okay, and next question, as a public health and dietetic program, do you want us to emphasize our experience more on public health or dietetics in our application?
To me, dietetics goes across public health, and public health goes across all areas of dietetics. That's part of that clinical public health approach that we were talking about. So I would like you to emphasize where you feel that you bring the greatest skills and interest in the field. The degree is a Master's of Public Health, but you are trained across all areas of dietetic competency, and we are in a clinical group. So you have the opportunity to expand your training and demonstrate your abilities across that entire continuum. Whatever makes the most sense for us to get to know you. Okay, and it looks like we have 2 more questions here. So how are references contacted this year? The references are actually not contacted directly. There is a form that's part of the online application that you send them a link and that they have to complete. And there's an area that is sort of just a check mark ranking, and then there's an area for their comments. And we really love their comments. The rankings are good, please, of course, but the comments, the more richness that they can provide about you as an individual there and their experience with you, the better. But we don't actually reach out to them individually. Mm-hmm. Okay, thank you. So if the public health emphasis is not offered for 2021, should I leave out my interest, this interest in my letter of intent? Well, I wouldn't call out the public health nutrition emphasis particularly, since no, it will not be offered, it won't be available. But you have a limited number of words to use to tell us about yourself. So I wouldn't bother throwing them in if they're not going to be helpful. However, if you have a special interest in population health or public health in particular through a particular public health agency, that might be very interesting detail for us to know without worrying about an emphasis. Okay. And we've had 2 more questions come in, so maybe these will be our last 2 questions. This is 12:57. Okay. So do you look at all 4 years of the undergrad transcripts to calculate the grade requirements for this program? The grade requirement, according to the School of Graduate Studies, is a mid-B average in your most senior year or your most senior full-time equivalent of courses. So at University of Toronto, it's a 5-course year. So they would look at the equivalent of the most senior 5 courses if you were doing part-time studies, for example. So it really comes down to how you've performed in your 3rd, because that's what we see here often for our candidates, and 4th year, especially as far as the averages are concerned. But as a program, we do look at things that you've done before. So we like to see trends. We do look at the rest of your transcript. We also like to see how you did in the statistics courses you had to take and in things like biochemistry, so that we know that you're like strong in those areas already.
Okay, and the last question here, they're wondering if they can see a copy of the reference form to know what will be asked of their referees.
I don't know the answer to that. So I would have to look into that before I can say one way or the other. I can't imagine that you won't know. I've had students who have asked me to provide references, and they have given me some pretty detailed information that suggests they kind of knew what was coming. So I think it's probably the case, but I can look into that and try and find out.
Okay, that's it for the questions.
All right, well, thank you, everybody. And I remind you to please take a look at those deadline dates, especially if you're interested in the advanced standing program. We are looking forward to seeing applications from a number of you and being able to review your candidacy for our program as we walk through the next few months. Thanks and best of luck.